thank you for participating in today's webinar. Of course, at AHP, we depend on our member organizations to submit data each year to make our report on giving a high quality and truly statistically significant review of healthcare philanthropy in the US and in Canada. So your participation truly benefits the entire profession. We're about 3 weeks away from the submission deadline, which is June 29th. So you still have some time to complete the survey. And to make it as easy as possible, we have two different versions of the survey. There's a mini survey, which is very short, and it just asks for high-level revenue and expense numbers, which hopefully you have at your fingertips already. And just for completing the mini survey, you get a scorecard report that shows your results in terms of several key board monitors like ROI, cost to raise a dollar, and others. And AHP members who participate also get a free copy of the full report on giving when it's published this fall. And then we also offer a full survey, which asks for more detailed information about revenue and expenses at the program level, including salary data. And when you complete all or part of the full survey, you get the scorecard, you get the report on giving, and you can also sign up for AHP's performance benchmarking program, which for an additional fee gives you access to many more detailed reports and lets you create your own comparison groups to run reports. So for example, you can benchmark your foundation against organizations that have a similar profile. So it gives you a lot of flexibility in the ways you use the data. So with that, I'll turn it over to Mike to walk through the survey and the submission process.
Great, thank you, John. I appreciate it. I think the first thing that I'd like to do is just sort of amplify what John had mentioned at the outset, and that's that we're sort of in the home stretch now. Basically, there are about 3 weeks left to participate. So I'm hoping that if you're on the webinar, that it's certainly something that you're considering participating in. You know, certainly enough time at this point, but it's going to run pretty fast, and some of the depending on the detail that you participate, the level of detail that your organization would decide to participate at, you may need, because there is salary data that I'll show you, so it may not be something that everyone would have access to. So it would be helpful if you are considering to participate, to look at the survey and look at what's necessary, because now that we're past Memorial Day, you know, certainly vacations are an issue, and trying to make sure you have everybody that you need available within a 3-week period when the summer's already started is sometimes a little difficult. So first of all, this is basically what I'm showing you is obviously a made-up, you know, demonstration hospital, and I'm going in with the same privileges that anyone who asked to participate in the survey would have. So the screens that I'm showing will be the same. The one thing that I would ask you to disregard, because this is a record, demonstration record, the deadline is June 29th, as John mentioned. It's not July 31st. So that's about the only thing, hopefully, that would be different. Let me say, first of all, the survey instructions and the blank survey form here are what I would recommend looking at before you start to complete the survey. The blank survey form, when you click on this link, will give you a PDF, and it will show you the mini survey that John had mentioned, where you would basically be able to answer about 5 questions and complete the survey, and I'll show you that shortly. And it also shows you the detail that you would be able to report in for the long version of the survey. The survey instructions have a lot of examples, especially when you get into the program area. If you were going to report your revenue by program in detail, gives you some examples of what would go into cash, what would go into production. Those are usually the areas of the report where we receive the most questions. It also has a glossary that would help you in case there's some terminology that's used in the survey that may or may not be the same or the same type of terminology that you use within your organization. So it would help to change that. One of the things I'm going to do right now, the first thing that you would see is this link that says choose or change your survey version. I'm going to go ahead and show you what it would look like when you get to the screen. As I mentioned, I wanted this to look like the screen you're going to have. So what you'll have is the survey instructions, the blank survey form. First thing that we would like you to do before you complete the survey is to check this box at the top. If you don't check the "we will complete the survey" box, then it's not going to allow you to open this up or start to review anything. So that's the first step that you would take. Assuming that you have the survey instructions and the blank survey form, then we come to this choice, and it's basically the mini or the full survey. So I'll go ahead and choose mini. You're going to see these errors that pop up here. This just has to do with the fact that this has already been pre-populated with data, and it may or may not be data that falls in within the validation checks for the system. So you can just please disregard those. So here's the mini survey. And as I mentioned, it's basically 5 questions. The gray areas that you're going to see throughout the survey, you're not going to be able to enter any data in. But if you did report in a previous year, as you can see in question 2 here, that data will be pre-populated. This is very helpful in case the same person at your organization is not filling it out the current year who did it the previous year. It would give them sort of a flow chart as they go through here, or a guideline rather, to see what was entered last year. Obviously, it would, from a trending perspective, it would be helpful that the person in the previous year had entered the correct data, but it's also a sanity check. If somebody is going through here for the current year and notices an unusual number or something that doesn't make sense, then it could be a way to go back and revise something. So what you will be able to enter a data in, though, is in these white boxes. There's contact information, organization type, number of staff beds. Based on the type of organization that you choose that you're going to report as, you're going to be able to see in this fundraising expenses and also in the fundraising results area. As I mentioned, only 5 questions. So this is basically all you'd be reporting. You can see the numbers previously reported last year for this demonstration organization. I mentioned the glossary when you were downloading some of the information at the beginning. There's also any of these underlined areas, you're going to see a short definition of what we're looking for in each of these areas, which would be helpful as well. So basically, we'd be looking for fundraising expenses in these 3 areas. So you have direct, human resources, indirect, and then basically overhead. As you can see here, if you really wanted to get down to the very limit of what, the minimum of what you could put in, you could actually just enter total fundraising expenses, and not, if for some reason you're not even able to break it out into these 3 areas. Certainly, the thing to remember all along, if you choose the mini survey, and certainly if you choose the mini survey and choose to not even fill that out in the same detail that's requested, you would still receive the report on giving, and you would receive access to the scorecard that John had mentioned earlier. Unfortunately, the fewer data points that you provide, then obviously the fewer areas that you're going to be able to compare yourself to other organizations. So that's just something to keep in mind when you're trying to do the pros and cons of, how much time you have, staff time, to complete this versus, what you would like ideally to get out of it from a comparison standpoint. So we have fundraising expenses, fundraising results. We're just asking for total cash, total production, number of gifts received, total number of donors, and then if possible, if you have that, if you didn't participate previously, if you could enter your 2016 total production. This is helpful for us within the database. And that's it. The comments that you see here aren't really about the survey in general. It's mainly about the mini survey. If you wanted to provide us some note here that we could go, maybe the reason why you're only reporting total expenses instead of breaking them out, or if your expenses are maybe larger, so your ratios are affected, you might want to mention that you were in a capital campaign or something that would temporarily change your ratios. That would be helpful for us. But again, you'd be done at this point, and you would just save and return to the previous menu, and you've completed everything. One of the things we recommend is to click on this link for the fundraising ratios. This will give you an idea based on what you've submitted. It will be calculated as soon as you note that you have completed the survey up here. You can run that, and then also for your records, it might be helpful to have a PDF of the survey. And again, as soon as you mark it complete, then you can print this as well. But at that point, you're going to be done with the survey. And so let me just get back up here. So what I'd like to do at this point is go ahead and change the survey version. We'll switch from the mini to the full. As you can see, this screen now looks a lot different. You still have your survey instructions and blank survey form at the top that I had mentioned at the outset, but instead of one link to complete the survey, you're going to see a lot of links opening up here. Actually, let me go ahead and hide this for now. So the first area that you can enter information here is the basic information about your healthcare system. If you noticed in the mini survey, you had the contact information here, but even starting with the question 2, you're going to see some additional questions here about your organization. If you are able to answer these, in the detail that is asked, then again, it's going to provide you more, the ability more to compare yourself to specific groups of hospitals or organizations that are like you. The pre-populated data is here. You would just choose your, fiscal year, presuming it would be the same. This is already defaulted to a system as far as organization type. So what you see below here is that because it's defaulted to the system, I'm not able to enter anything into this 4A because it's single entity only. So for the system only, I can enter all of the information that's asked for based on the type of organization or hospital that that you're raising funds for. And if we went back and decided that this was incorrect, or somebody had put this in last year, and even though they were able to report as a system last year, for this year you'd like to change it and only make it reporting for a single healthcare entity, then you can obviously do that at this point, and then this area you won't be able to report here. Goes into net operating revenue. Hopefully you can provide this broken out into net for profit and net not-for-profit rather and net for-profit. But again, if that's something that's not able to be done for whatever reason, you are able to just enter a total in here. The net patient service revenue, if there's something that would be interesting about the calculation method, if you could go ahead and put that in here and just to let us know, that would be helpful when we're reviewing the data in the database. And then it's going to ask if you're part of a system. If you're a system only, the fundraising expense budget, and then the funding relationship. Same thing on the comments here. If there's something that would be helpful for us to know about some of the information that you provided in this area, then if you could let us know here, that would be great. And then you're done. So we'll go back to the previous menu. Next area is fundraising expenses. I had this open originally, but then I wound up keeping it closed just so I could show you the choices that you have here. If anyone's familiar with the previous report on giving, basically, if you wanted to follow the detail that we asked for expenses in that report, you would choose summary only. It's going to give you the boxes that you saw in the mini survey for fundraising expenses. When you click on this, you're going to see, the direct, indirect, overhead, and then a total. If, however, you are able to provide expenses in more detail, then what you can do is go into this area and then choose the detail. And what it'll do is it'll open up each of those buckets for direct, indirect, and overhead into their own links. And then when you click on, you're going to see everything fleshed out in a lot of detail. This is what I mentioned at the outset where, even though we've got 3 weeks left, if you did choose to report expenses in this type of detail, then most likely you're going to have somebody with HR privileges within your organization that's able to see salary data. And as you can see, there's a lot of information that's asked for here. Actually goes over here to the right as well. And the whole key to this would be trying to look at the number of staff that you have, and then trying to obviously you have a section here for combined compensation, but you'd be trying to apply the percentages that would be for each of the programs moving from left to right after the compensation is listed. So it's definitely something where some of these may or may not apply to your organization, but if you are able to fill out the expenses in this type of detail, it's going to reward you with the access to the database that we mentioned earlier, because your comparison groups are going to be much more robust. Let me go back to previous menu here. And the indirect menu, the same thing. I mean, it's basically just looking at direct staff versus indirect staff. The overhead, excuse me, you'll be looking at your rent, supplies, travel, and then any type of outsourcing that you do for services. But again, the same type of application where you're looking to apply the combined salaries or the total number for these expenses to the different programs from left to right. So at that point, your just about halfway through, if you were looking at this from, again, the old report on giving survey, the area in that survey, and certainly in this survey, where things are very much the same. In fact, I don't think that they're any different at all. It has to do with the next section that we're going to get into, and that's the gifts received and expected. If you recall from the mini survey, what we were asking for was just total cash and total production. You can see these programs as I scroll down: major gifts, corporate, foundation gifts, etc. But they're basically all going to roll into a total down here for cash and production. So if you are able to report your revenue, the funds raised by program, this is going to give you a tremendous ability to compare your data. If you were able to report the expenses in detail and the revenue in detail, again, more data points. If, however, you were only able to report, I guess if I was going to suggest, if you can report one in detail but maybe not both, if it's possible, the revenue would be the best way to get the most comparison points out of what you present. If you didn't want to get into providing compensation data specifically by direct and indirect employees, then if you just entered the expenses in those buckets that we showed, and you, in this section, reported by program in detail, you're going to get a lot of comparison points out of that. Let's see. These are all pretty straightforward, but again, one of the things that may be not intuitive, depending on when you're filling out the survey, how you look at things, the numbers that roll down into cash and production, it's good to keep an idea on that in the back of your mind. I mean, some of this is pretty straightforward. If you're looking at annual gifts, the actual gift is going to go into cash and production. When you get down to the pledges, clearly you're not receiving anything at that point. You're receiving a pledge, so that's going to go down into production rather, and then the pledge payments are going to go into cash. So it's just when you report in this detail, feel free to contact us if, when you get to the bottom here, if you already had a total cash and total production and you're looking to fill this in, if for some reason it doesn't match up, please feel free to reach out to us. We'd be happy to help you. As I said, any type of survey, there's a sort of certain compromise. So if for whatever reason your organization doesn't track things exactly the way that we have in the survey, we would certainly be able to help you explain the difference, or we could explain the difference based on the platform, based on the logic employed here. So again, feel free to reach out to us. There's a couple of other areas here: gifts over 1 million, pledge collection rate. Again, the more you're able to provide, the more areas that you're going to be able to compare yourself to with the database that I mentioned. I guess I'll take a break here. I've been sort of rolling along here. Does anyone have any questions, or am I moving too fast? If there's anything that you have a question about, please feel free to type it in, or just let me know. And please, you can interrupt me if there's something that I'm saying that's that you're not quite understanding. Just let me know. I mentioned the report on giving, the previous report on giving, a couple of different times. What AHP did last year was sort of marry the report on giving with the previous benchmarking survey onto this platform. So since there were more organizations that had participated in the report on giving previously, that's why I'm mentioning about the previous report on giving, just in case you wanted to participate in this at a similar level of detail. The full version of this survey definitely has more sections and more detail than the previous report on giving. But as I mentioned before, if you wanted to report at the level of the report on giving, if you did this Section A, Section B, fundraising expenses without the detail, the gifts received and expected with the detail, and then this last section that I'll get to shortly on use of funds, basically where does the money go that was raised, that would be very similar to the detail from the report on giving. So these next sections that I'm getting into here are if you want to report at the benchmarking level, these would be very important as well. So we first get to endowments and campaigns. This may or may not be applicable to you for this year or even to your organization in general. As you can see, the campaign goals here, if you happen to be in a campaign in 2017, then certainly if you could put that information in, that would be great. But it's only if you were in a campaign for that particular year. Let's get back to the menu here. Constituency giving. Again, this is a section that you hopefully would have access to be able to provide this. Looking at employees, looking at the total number, non-physician, trying to get to a total donor number, total production number based on all of that. Gifts by position, gifts by source. Again, maybe too much detail, but if you happen to be at an organization where you can track this and you have easy access to it, it would definitely be something that would provide you with more data points. Then this section here, just looking at major gifts, corporate gifts, foundation gifts, planned giving, just trying to flesh things out. A lot of this has to do with measuring effectiveness. So as you have a total here on what you had received, you would try to try to go back to what you had to do in order to raise those funds, and then just sort of look at things from an efficiency standpoint. Same thing here with annual appeals. When you go back and look at calculations based on that, it may be something that maybe you'd want to change some of the mix of what you're doing. If you're noticing that something's not, maybe it was effective in previous years and now it's not giving you the same return. It's a good way to go back and look at that if you are able to provide that detail. Okay, then there's a couple of these are optional. The program emphasis, that's just looking through and seeing within those programs that we mentioned numerous times, if you are able to report the revenue in that detail, then if you're able to go through here and mark the level of emphasis, it would sort of help to put things in perspective if perhaps there's not a lot of, if you don't have a lot of revenue, say for government grants, if it's something that's not even something that you court, then this grid would be a good way to sort of navigate your way through. And then you could see if it's something that you are that you have a very strong level of emphasis in, and the revenue is not quite matching the emphasis that you're putting on it based on what you're expending as far as expenses and resources, then it might be a good way to sort of recalculate that as well. Then the last section has to do with use of funds. I mentioned it earlier because this was included in the previous report on giving. Not everybody has the visibility to see this, but if you do, again, it's very helpful to sort of see, the money that came in through whatever program, where did that money go? And from the perspective of how the funds were raised, basically you would just distribute everything here regardless of how they were collected. This is just basically saying, where did it go to? And then there's a couple of areas here with interest income and endowment income as well. But that's it, and then you'd be done. Again, I would mention the same two things that I mentioned on the mini survey. Once you mark it complete up here at the top, you can look at your fundraising ratios. If you are able to report your revenue in detail, you're going to see a lot more ratios here than you would see with the mini survey. Basically, I didn't click on the link, but if I did click on this link for the mini survey, you wouldn't see anything below this red text here. You would see cash, you would see production, and you would see hopefully these expenses that you provided. And you would see, calculations here based on return on investment, cost to raise $1. But if you're able to provide the revenue by program, then not only will you see a total cash and total production, you're going to see your ROI and cost to raise $1 and various calculations based on the actual program for cash and also for production. This is helpful because it's calculated as soon as you put the data in. So if for some reason you see a number here that looks really unusual, maybe you're expecting to see your cost to raise $1 at, whatever, say 20 cents or something, and all of a sudden you look and it's, 40 cents or something, and you think, well, what's going on? Maybe it could be that someone entered an incorrect number, or for some reason it wasn't calculated correctly. And certainly if you think that the calculation that's from the database is not correct, again, please feel free to contact us. We'd be happy to look at your data. Excuse me, and to give you any assistance that you need. The last thing I mentioned is the PDF of the survey. Again, just helpful to have that. The database is still open. Let's say that you entered everything and you marked this completed today. And the database, as I mentioned, doesn't close for another 3 weeks. It's not an issue. You don't have to, just because it's completed, you can go in anytime until the database is closed and change something. So if you did print out your ratios and you were concerned about it, you can just go and check, do whatever you need to do, and then just come back, uncheck that you've completed the survey, go in and change anything that you wanted to change, and then just recheck the survey again. And that's it as far as reporting. Does anybody have any questions about the process or the sections of the report? If you don't have any questions, then I think the easiest thing here, excuse me, would be to show you some of the reports that John had mentioned. Again, this is the survey menu. And in order to show you the reports at this point, I'm going to have to switch back to being an admin here. Because this isn't something that's available to you until the database is closed. John had mentioned comparison groups, so let me go into that first. Excuse me. When you look through here, you can see a couple of things. Number one, there's public groups. These are comparison groups that were created by AHP, I think for most of the years of the survey, looks to me like, I guess they didn't put fiscal year up here, but yeah, it looks like it's from 2012 all the way through 2016. And this should say fiscal year here, but in any event, you can see ones that are, more robust, the ones that you would expect. I mean, if you're looking at community hospitals, you're going to see a pretty substantial number there. And you have one on just the U.S. report on giving participants, and then one on the Canadian. What you can do with these is two things. Number one, you can use the groups that are already here. And let me go back to the predefined reports here and point out the scorecard that John mentioned. Now, on this menu, because I'm signed in as an admin and I have access to everything here, for free, basically, if you don't pay for access to the database, the only thing you're going to see on this menu is the scorecard. But it is a very good measure. So let's just go ahead and click on the scorecard. You're going to see that the focus organization here is Demonstration Hospital, the made-up organization that we set up. Just for comparison purposes, to get through this quickly, let's just choose community hospitals. When you do this after the database is closed, it'll default to 2017. But clearly, we don't have enough data in here for 2017, so I'm just choosing 2016. We're going to include Demonstration Hospital, and then we'll go ahead and bring this up. There's some information here that tells you about the scorecard, interpreting return on investment, cost to raise $1. And then you get into the actual scorecard here. And again, this is free. If you did the mini survey and then you just decide that's all you can do, you would get the report on giving. That's PDF that's very detailed with a lot of tables. And then you would also have access to the database, and you would have access to the scorecard. So you would have, and if you were setting this up, you would choose your organization as a focus group. So depending on, getting back to the detail that I had mentioned, you may or may not have information in all of these areas, but what this will do is tell you, based on the organizations, the comparison group that you chose, it'll give you a mean and a median, excuse me, and then some percentiles, quartiles and percentiles as well. And at the bottom of this, depending on the comparison group that you create, it's very important to sort of look at these last two rows of numbers here. This is going to give you the number of organizations in the comparison group at the bottom. You can see that that remains the same through every breakout. But that does not necessarily mean that every organization that's in the comparison group reported data in each of the areas. So you can see the drop off in some of these down here, total endowment, as I mentioned, that may or may not be applicable to a lot of organizations. So that number is significantly lower than what you would see for total fundraising expenses. Again, all very reasonable. You would think that most people are going to be able to report total fundraising expenses and their total revenue, broken out into cash and production, but they may or may not be able to report their endowment, maybe because they don't even have it. Same thing with some of these other areas here. But you can see that this is fairly robust for something that basically you're not even paying access to. You can export this as a CSV file, so you can get it into Excel. Let's say you did the mini survey, so maybe some of these numbers aren't going to show up. But if you throw this into Excel, you're going to have your comparison group numbers from who you want to compare to, and then maybe you could actually go in and put your numbers in. So you have the ability to create that, and there's no additional fee for that. gives you some graphs as well. Clearly, the data that's in here is not very helpful, but you can see that this is the community hospitals and our demonstration hospital. You know, not doing too well. But you can download this as an image and also into Excel, like as a CSV file. So let's go back. Let's just look at it from the perspective of creating a comparison group real quick here. Again, this is something that, regardless of whether you pay for access, you would have the ability to do. You would just choose this new group wizard. Okay, then you have some choices to make here. Let's choose non-data sharing organizations in the US. And we'll say the report on giving survey, but again, you'll be able to leave this defaulted to 2017, but I'm just moving it back to 2016 so we can see something. Affiliation, we'll just choose unspecified. And organization type, I guess we'll go ahead and choose unspecified here as well. Okay, for the survey variables, you're going to see a drop-down list. Let's just say you wanted to look at comparison groups based on number of direct fundraising staff. So you would just add that, and it's going to ask you for a number. Let's say between 3 and 7. That should give us something fairly robust, I would think. And let's see. Yeah, I think that's good. So what you do is just go back to the predefined reports then, and then choose the scorecard. And this is going to give you the same information, but you're going to be creating it based on your comparison group. What you need to do then is, depending on how you're going to use this, actually, let me get back in here. I should have gone ahead and saved this. Actually, they only give us one organization. Oh, well, that's my fault. Let's just make it, we won't choose anything here. Or actually, let's open this up a little bit more. Let's make this between 3 and 10. And unspecified. Well, still not helping. Oh well. Anyway, that's basically how you would create the comparison group. I should have worked on my areas there a little bit more. But the main thing is that you could create the comparison group, and depending on the criteria that you choose, you can save it. The thing to remember is from a confidentiality standpoint, that the more tight you make the parameters, as far as, say, that one that I chose about fundraising staff, since we only have approximately 240 organizations in total that participate, if it is too narrow, then from a confidentiality standpoint, it's not going to show There needs to be a minimum of 6 groups, 6 organizations in order for that to show. But let me go back and show you something based on the predefined reports again. One of the things that you could do for a fee is get a basic subscription. And the difference is basically trending if you're looking at the basic subscription versus what you would get for free. If you recall on the scorecard, it's just giving me the current year. Whatever year I would choose, it's going to give me that data for the comparison group, and it's going to give me my data, and I'm going to be able to see how I compare, but it's not going to give me any type of history. If you were to get the basic level, if we went through and chose community hospitals again for 2016, it's taking a little bit to open up. Okay, is everybody able to see my screen?
Yes, I can see it.
Okay, great. The thing that you can see here is that you look across the tabs at the bottom, you're going to have some of the same information that you showed that we were looking at in the scorecard, but now you're seeing the same information, but it's on a 5-year trend. And again, this is, well, this obviously doesn't make sense, but for the information that's in here, if you have, if you're just reporting for this year, and you want to get an idea from a trending perspective, if you were able to access this from the basic subscription level, you would have access to the information that I showed in those comparison groups that went all the way back to 2012. Clearly, your organization would not be in those groups, but it would be helpful to sort of put these numbers in perspective over a longer period of time than just a snapshot for 1 year. So that's what, from the perspective of the difference between with the different access to the predefined reports, I think that's the big difference here as far as basic versus the scorecard. Now, for the advanced, it actually gets into each section of the survey. If you recall from the menu that I showed you for the full version of the survey, this basically mirrors all of that. You have your demographic data, your expense data, either with or without compensation, gifts received, endowment, etc. And you can run reports based on every single section of the report. And then also looking at reports based on gifts in different program areas. And again, everything below this scorecard would be something that you could subscribe to. Once you subscribe, or even if you don't, if you just complete the survey, you're going to have access to be able to create your comparison groups within this. You can save them. You could share your comparison groups with other people in your organization. Everybody's going to see the public groups that I mentioned at the outset, but the shared groups section here, these are just ones that people have set up within organizations. Now, they're not going to be available to the public. I can see them because I'm an administrator, but basically, you can save the comparison group. You could share it within people within your organization, as you can see from the bubble here. So you don't have to worry about creating a group and then thinking that people outside of your organization are going to see it. They're only going to, when you save it, it's going to go into this shared groups, and it's up to you whether or not you want to share it with somebody within your organization. And then obviously the difference is that everyone's going to be able to see these public groups, whether you paid for access or not. Let's see, I think that's pretty much it. Did anybody have any questions? I know that's a lot of that's a lot of information, especially if you haven't been on the platform yet. But that pretty much covers it. As I mentioned, we're recording this, so if for some reason, if you were on it earlier and maybe somebody had to drop off or you arrived late, I'm going to send out a link to this webinar to everyone probably at some point tomorrow, and then you can access that. And we're available. Our information is on the platform. We're very happy to answer any questions that you have. You can email us. You can give us a call. If there's maybe within your organization, there's multiple people that need to be involved, we'd be happy to try and set up a short conference call to go over things in case there are, if you're going to report compensation, it might be something that you want to have more than one person involved. We'd be happy to do that.
Thank you. It's really helpful.
Okay, great. Well, thanks, everyone. I appreciate you sticking with us. Again, I think the takeaway is that clearly the more information you can provide, the more data points you have to compare yourself to. But if for some reason you just don't have the ability this year, or you don't have the time, that there is a very easy way to just basically answer 5 questions, and you would have access to the database at a scorecard level, and you would also get the free report. So thank you very much.
Thanks for your time.
Thank you. Bye-bye.
Bye-bye.